Are you tired of waking up stiff every single morning? Tired of wincing on the stairs, skipping activities you love, or just quietly accepting pain as part of your day? You don't have to. There are more treatment options available for joint pain than most people ever find out about. And today we're going through all of them. Every single pound of extra body weight puts 4 pounds of pressure on your knee joints. So before anything else, the single most impactful thing you can do costs nothing. Move more and eat better. Even a 10-pound weight loss has been shown in clinical research to significantly reduce joint pain and slow the progression of arthritis. That's not a small thing. That's a life-changing thing. Now, when pain flares up, start with ice. Wrap it, apply it for 15 to 20 minutes, and repeat every few hours. Ice reduces swelling and numbs the area fast. After 48 hours, switch to heat. Heat relaxes the muscles around the joint and improves circulation. Most people do this backwards. Ice when they should use heat, heat when they should use ice. Get the order right and you'll feel the difference. Don't stop moving. This is counterintuitive, but completely resting a painful joint is often the worst thing you can do. Cartilage is like a sponge. It absorbs nutrients through movement. Without movement, it dries out and breaks down faster. Swimming, cycling, and walking are your best friends. Low impact, high benefit. 20 minutes a day is enough to make a real difference. For topical relief, look past the basic menthol creams. Diclofenac gel is a clinically proven anti-inflammatory you apply directly to the skin over the joint. It targets the source of pain without the stomach problems that come with oral anti-inflammatories. It's significantly underused, and it works. When it comes to oral medications, there's an important distinction most people don't know. Ibuprofen and naproxen are NSAIDs. They reduce both pain and inflammation. Acetaminophen only reduces pain. If your joint is swollen and stiff, acetaminophen alone won't touch the inflammation causing it. NSAIDs are the better choice for most joint conditions, but they carry real risks with long-term use: stomach ulcers, kidney stress, cardiovascular issues. Use the lowest effective dose for the shortest time possible, and never make them a permanent daily habit without medical guidance. If over-the-counter options aren't enough, a doctor can prescribe stronger NSAIDs or a short course of oral corticosteroids, a steroid pack that rapidly brings down severe inflammation. For rheumatoid arthritis specifically, disease-modifying drugs called DMARDs don't just mask symptoms. They actually slow the disease itself. If you haven't seen a rheumatologist, that conversation is worth having. Physical therapy is the most underrated treatment on this entire list. Joint pain is rarely just about the joint. It's about everything surrounding it. Weak or imbalanced muscles put abnormal stress on joints that weren't designed to absorb it alone. A good physical therapist identifies exactly which muscles are failing and corrects them systematically. For knee pain, it's almost always about quadriceps strength. Weak quads are a primary driver of knee osteoarthritis progression. For hip pain, the gluteus medius, the muscle that stabilizes your pelvis when you walk, is usually the culprit. When it's weak, every step sends an uneven load through your hip. For shoulder pain, rotator cuff strengthening is non-negotiable. Those 4 small muscles are holding your shoulder together, and when they're weak, even simple movements cause grinding and impingement. Here's what the research actually shows. Multiple large clinical studies have found that a proper course of physical therapy produces outcomes equivalent to surgery for many types of knee and hip pain. Not slightly worse. Equivalent. At a fraction of the cost and with none of the surgical risk. If you haven't committed to a full course of PT, it needs to be your very next step. If conservative treatments aren't providing enough relief, there's a full range of medical procedures available, and most people only know about 1 or 2 of them. Corticosteroid injections deliver a powerful anti-inflammatory directly into the joint. Relief can come within 24 to 48 hours and last anywhere from weeks to several months. It's not a cure, but it gives you a pain-free window to make real progress with therapy and lifestyle changes. Hyaluronic acid injections, sometimes called gel injections, replenish the natural lubricating fluid in the joint that degrades as osteoarthritis progresses. They're most effective for knee osteoarthritis. Results vary from person to person, but for many patients, they provide months of meaningful relief. Platelet-rich plasma, or PRP, is where the science gets genuinely exciting. Your blood is drawn, spun in a centrifuge to concentrate the healing growth factors, and injected directly into the damaged joint. You're essentially supercharging your own biology and delivering it exactly where it's needed. The research is especially strong for knee osteoarthritis and tendon-related pain. It's becoming more widely available and more covered by insurance every year. For severe chronic pain that hasn't responded to other treatments, nerve blocks and radiofrequency ablation are options worth knowing about. Radiofrequency ablation uses targeted heat to deactivate the specific nerve fibers transmitting pain signals from the joint. It's minimally invasive, done under local anesthesia, and the results can last 6 months to well over a year. What you eat every day is either actively fighting your joint pain or making it worse. The Mediterranean diet, olive oil, fatty fish, leafy greens, berries, nuts, whole grains, consistently shows up in research as the most anti-inflammatory eating pattern available. Processed foods, refined sugar, alcohol in excess, and trans fats do the opposite. They raise inflammation throughout your entire body, including your joints. On the supplement side, glucosamine and chondroitin have mixed evidence but low risk. If you haven't tried them consistently for at least 3 months, they're worth the experiment. Omega-3 fatty acids from fish oil reduce systemic inflammation and have strong evidence behind them, particularly for rheumatoid arthritis. Turmeric's active compound curcumin is a legitimate anti-inflammatory. Just make sure your supplement includes piperine, the black pepper extract that increases curcumin absorption by nearly 2,000%. Without it, most of what you swallow passes straight through. Collagen peptides round out the list. Earlier stage research, but promising, especially for active people dealing with cartilage wear. Surgery is neither the enemy nor the magic answer. It depends entirely on your situation. For end-stage joint degeneration, where quality of life is severely impacted and conservative treatments have genuinely been exhausted, knee and hip replacement surgery has some of the highest patient satisfaction rates of any elective procedure in medicine. When it's the right call, it changes lives. But here is what the research also shows clearly. A significant number of people who are told they need surgery get equivalent outcomes from physical therapy and injections. That's not opinion. It's in the data, and it makes a lot of surgeons uncomfortable. Before you agree to any operation, get a second opinion. A confident, ethical surgeon will encourage you to. Joint pain is not a single problem with a single solution. It's a spectrum, and the right approach depends on your specific joint, the underlying cause, and where you are in the progression. Start with the least invasive options. Move every day. Address your weight. Commit to physical therapy before you consider anything more aggressive. And if that's not enough, know that there is a full ladder of options still available to you. You do not have to just live with this.